Yeah, that's a great question. And I don't know that we have the full answer for this, but what I'll share is just kind of how my thought process has evolved over the years. I think adherence to anything, much less an exercise program, has a lot of factors that we don't always think about, or maybe new physical therapists, because you learn things in school. We didn't, at least when I went through school, we didn't really spend a lot of time trying to understand human behavior. Human behavior is complex, and human behavior, it's not as easy as just telling someone something. And so I think we as physical therapists, or just as people in general, just think that if I tell someone something, that knowledge will then change into action. And so we don't understand the complexity that comes with actually changing behavior, which is really complex. So we spend a lot of time educating patients, thinking that that's the gap. I think our biggest error is thinking that there's a knowledge gap. And if we fill that knowledge gap, that's the golden egg right there. And so we just have to tell people if they have knowledge, then they'll act differently. So, but we know that people that smoke it's not a knowledge gap. I don't think anybody that smokes doesn't know that it's bad for them. They just do it anyways. And we probably find ourselves doing variations of that as well. Like maybe we know eating this or drinking that isn't necessarily good, but sometimes we do it anyways. And so I think most patients probably would agree that the exercise is good for them, but just having them agree that it's good is not the only thing. There's a lot of factors that then come into whether that behavior actually plays out. And so some of those are economic factors. Maybe if you're just really, really busy, you're a single parent, you just don't have much time, you have other things to prioritize. Maybe you think it's efficient but beneficial, but you just have other things that take up your time. I think I truly think that a lot of patients think it's good. They go to bed at night thinking, oh shoot, I forgot to do my exercises. I'll do them tomorrow. And then tomorrow comes and they get busy. And so every night you go to bed and you always mean to do the right thing, but unless you sit down and plan out how you're going to change your behavior, like it takes some planning. It doesn't just happen. We talk about SMART goals. We talk about creating a structure for changing behavior. Like patients need more structure. Those that struggle with this need a little bit more guidance to help set up a plan where they can actually do something. And at least I wasn't very good at sort of helping to set that up, when I first started practicing. And so I think there's a lot of barriers. And the first thing we can do is just admit, I guess, or realize that behavior is very complex and that it isn't just a knowledge gap. So just by telling people things doesn't mean that they're actually going to start changing their behavior and doing things. Even if it's something that's good for them and beneficial, behavior is a lot more complex than that.